Overview and Scrutiny Committee. This meeting will be webcast live as it's been recorded and archived for 12 months. It can be viewed on the link. If anyone is present, they are given their authority to be recorded. Apologies, please.
Thank you, Chairman. We've received apologies from Councillor Anne Edgeler, Bob Spencer and Kath Perry.
Thank you. Any declarations of interest, please? Thank you. Item 3, minutes of a safeguarding overview and scrutiny committee held on the 15th of June 2023. Everyone has received a copy. Are you happy that they are accepted as true? Thank you. Proposed? Seconded? Thank you. Okay. Item 4. Customer Feedback and Complaint Service, Adult Social Care Annual Report. Sorry, can I just go back for minutes? An addendum minutes has been included. That covers the third part of the focus and future item. Is that also accepted? Thank you. Okay, now we'll go to item 4. Customer Feedback and Complaint Service, Adult Social Care Annual Report, 2022-23. Councillor Julia Jessel, please.
Thank you very much, Chairman. I'll make a brief introduction and then Kate Bullivant, the manager, will perhaps come in with some more of the detail. As you well know, we have a duty to publish this annual report on the statutory complaints and representation service, and the report is on a similar format. I'm only surprised that 12 months seems to have gone so quickly since the last time I was here. There has been, and I think I may preempt some of the questions that you have, in the fact that there has been an increase in complaints regarding financial assessments. I raised this issue last year of financial assessments. It is a fairly contentious operation in the fact that there are quite a number of people who don't want to pay if they're liable to pay for some or all of their care. But equally, in the autumn of last year, Councillor Parry and myself, Councillor Parry because it's a financial process, instigated a review about the procedures and also the significant amount of documentation that we require from receivers of these services before a financial assessment can be made. In my view, that was overly bureaucratic, and we've now agreed a simplified process which makes it easier for those who are receiving services. They're not required to submit such a significant list of documentation, but at the same time protecting the council and the taxpayer and making sure that people can't diddle the system. So that process is now being rolled out and actually should start to impact on the number of complaints because it'll be a quicker process. There are things like direct debits now are the default option. Obviously, there are a decreasing amount of people who don't have a bank account. If you receive any state benefits, pensions, or anything like that, they now have to have a bank account. So it's becoming more and more normal practice than the current system that we had, which was sending out invoices, sending out a chasing one a month later, and a final demand after that, by which time people have got into debt and quite difficult to recuperate. So I think it was important that I set out that we are trying to address this by making it more efficient from the council's perspective, but easier to understand and easier to be involved in from the user's perspective. It is an ongoing project because what we are doing is reviewing and improving the information that's available online. The information is there but by the time you get through to the bit you want, you've almost lost the will to live. It's not user-friendly from the public's perspective. It's great if you're a professional and you know how to navigate your way through. So that is a project that is ongoing, and it's with the view that actually we can get to the point where users of the service or their relatives or friends can actually do a self-assessment online. But we're a little bit away from that, but that's where we want to get to. And obviously, one would hope that will have a really positive impact on the number of complaints we get about financial assessments and the communications. So I thought it was important to set that scene and set your mind at rest that we're not just saying, okay, we get so many complaints, that we are actually trying to do something about it.
Can you just make a comment at that stage? Health and Adults Scrutiny Committee have a workshop scheduled on the 23rd of October to test out the process for the access to financial assessment. So we're actually looking forward to testing, seeing if it all works for the future.
And indeed, that was at my suggestion that we actually, in a way, use counsellors as guinea pigs in the nicest possible way so that they can test the system and come up with advice and as to how it could be further improved, which I think is really important because from a local counsellor's perspective, if you get a query, if you know how the system is working, you can advise people, which I think is important for all counsellors. In terms of, the proportion of complaints, it's a relatively low proportion with the thousands of interactions we have. I think one of the issues that Councillor Spencer wanted to raise is, will we ever get to zero complaints? No. Actually, if we had zero complaints, I would be worried. I'd be worried that actually we were not being open and accountable. It's good practice to make it easy and accessible for people to raise concerns and complaints. So we won't ever get to zero, but I do think we need to be seen to be actively improving our systems. Thank you very much, Chairman.
Kate.
Good morning, everyone. I'm Kate Bullivant. I'm the Complaints Manager for Stafford County Council. As Councillor Jessel has said, lessons learned are very important, and we have a good working relationship with our colleagues in finance and all the managers within adult social care. It's important from a complaints perspective. We have those open communication channels, so we are really pleased to see that things are moving forward in changing the system for our adult social care citizens who need a simple assessment process to actually look at finances. So, on to the annual report. While complaints have gone up, it is a positive annual report, bearing in mind, as Councillor Jessel, the amount of interactions, as are stated on page 14, that we have with adult social care people who require support. When a complaint comes in, we assess it to see if it is actually a complaint or is it a safeguarding issue. Obviously, it's very important that we support our complainants to go down the right route. And if it is a complaint, we do look at it to see if we can informally resolve it. And as you can see from the report, we had 159 enquiries where we were able to resolve the issue without it going into the process. Whilst if someone wants to make a formal complaint, and it's very important that we look at it from that aspect, because this is a statutory complaints procedure with the ultimate being the Ombudsman. If we can resolve it without going through a 20-day timescale, it's important that we do. When a complaint comes in, like I say, it's risk assessed, then it's defined, because you can have pages and pages of a complaint. And to ensure that we are responding to the complaint fully, We look at that, we define complaints, we go back to the complainants and ask them, are they happy with how we've defined their complaints? It is then sent to an investigating officer to actually investigate the concerns. This statutory procedure actually has no timescales. You are supposed to actually discuss that with your complainant, but to ensure that we get a response out in a timely manner, I have said we do it within 10 to 20 working days. If we can't do it within that, we go back to the complainant, explain the concern that we have. We could have someone on holiday. With this being a complaints procedure that covers our health colleagues as well, sometimes we have to go to a hospital and say, can we talk about what happened on discharge, etc. So that actually makes the complaints procedure a touch longer. Once the response has gone out, we ask the complainant, are you happy with that? They do have the opportunity to come back to us, or they can go straight to the Ombudsman. Obviously, we don't like things going to the Ombudsman. It extends the process, but we have to give our complainants the opportunity. We have to show that our complaints procedure is open and people can access it easily. So therefore, we do online, we do email, we do letter, we do phone. So therefore, you can ring or you can write or you can just fill an online form in and we will then respond from that perspective. Top 3 areas of complaint are delay in receiving a service, and that is around our adult learning disability team, but also our finance team. Financial assessment, the assessed charge, as Councillor Jessel has talked about, we have a delay in people being assessed to receive care and then the financial assessment kicking in. So we do have some citizens that are receiving care and they're not aware of what that charge will be until later on, which is obviously something that has been sorted, and invoice issues. And they are, again, based on the fact that we aren't timely in respect of saying what the assessed charge will be. So they are the top 3. The Ombudsman, our working relationship with the Ombudsman has to be good. I don't know if you saw the annual letter that came through a few days ago. I know that Councillor White sent it to all. The numbers remain constant. As you will see within the report, the total amount of monies paid to complainants as an outcome of an Ombudsman investigation is £2,870. And this is in recognition for the time and trouble in raising the complaint and any distress caused. I have got some questions that came from the which I'm happy to go through. Okay. So the first one was about training, and the question was, could we offer better training for those at first point of contact? Could staff resolve things in the first golden hour to avoid escalation to the complaints team and prevent frustration building when the matter could be resolved at the first point of contact? So, first point of contact, they do attempt to resolve the issue. So, for example, I'm always aware that if people ring and they are saying, I'm not happy with our first point of contact, whether it's finance, let's take finance as an example, we try to resolve it at that point. It's their bread and butter to say, let me just look on the system. Yes, I can actually see that you didn't have a care visit on XYZ time. Once they've done that, and if the person is still unhappy, we have to be aware that they want to make a formal complaint, because we have to give them the opportunity to access the Ombudsman. If we can resolve it, we do. The training, we are changing our ways of working, because a lot of people feel that if they don't have a written response to their concern, it's not been addressed. So that's a bit of training we're doing as well within the adult social care arena. So We can't block access, and we will always encourage early resolution if possible. So the second question was, the council felt we need to add more context around the increase of complaints. As Councillor Jessel has talked about, the increase is around finances, and it did mention it within the adult social care report. I always have to be aware that this is a public report as well, so they're putting in detail about specific issues would breach confidentiality, etc. So the councillors want to know if we can control the increase, or is it out of our control? What are the external factors? We could assume, i.e., complaints about the weekly assessed charge could be rise of cost of living, etc. But we don't have factual evidence to show one way or the other in respect of this. We know that there are issues within finance. We're addressing those. We know there's issues within adult learning disability. Those are being addressed as well. But I can't say what the external factors are because I wouldn't know that. So, are we using valuable resources to investigate complaints formally that could be used elsewhere to decrease complaints? It is felt that staff investigating formal complaints could be better placed using this resource to resolve the complaint before it reaches the investigation stage. Could the team manager be better placed getting involved when the concern is first raised, rather than using up their time formally investigating? Or is there a resource elsewhere that can be used to decrease complaints? First of all, I need to say that a team manager isn't always available when a complaint comes in. This is on top of the day-to-day, doing a complaint, investigating a complaint. This is a stat process, and therefore, if someone says they want to make a formal complaint, we have to accept they want to make a formal complaint. The duty information within the annual report evidences how we try to resolve as much as we can. However, there are some complaints which require investigation. If there's been ongoing issues or conversations, for example, a social care package, there's issues in respect of that, there may have been ongoing conversations with the team manager, and therefore the only way to resolve it is an investigation. Yes, of course.
Forgive me. I think this is quite important, though. The purpose of the pre-meet is to give you a heads up as to what's coming. And I think that those who are minded, and there are likely to be few of them, granted, to watch this online, won't fully appreciate where these answers are coming from. And it'll give the impression that the committee is not fully on the ball. And I wonder whether the questions should still come from us, even though you're going through the business of answering them. I don't wish to appear rude. I'm very grateful for the fact that you've got them, but I do think there's a perception piece here, and I just wonder, Chair, whether you agree with that. And
I think the questions were given by the chairman to Kate so she can get the proper answers, so she can come forward with the more detailed answers. People here are free now to ask any supplementary questions, any additional questions. And for anyone who is watching, these were questions that we have a pre-meet to this meeting. These questions were put forward by members of the committee, also people who aren't here today, basically so we could get the honest answer. And I put the honest, not the honest, the fullest answer is the best way to put it. And that's why it's been done. Councillor Eagland.
Yeah, I totally agree with what you said, because getting this overall pattern from the officer and also the cabinet member, I think it gives us an overall look of what we're doing. We've read our papers, but to listen to the things that are going on, something just might click into our head that we need to stack up, and we've got notes where we can ask questions afterwards. So I'm happy with the way it's proceeding.
I mean, to be fair to Councillor McMahon, I was actually thinking the same as Councillor McMahon was saying, that if anybody is watching it, asking the question where the questions have come from. So at least now people will know where the questions have come from and the reasoning. And I think we'll have to review it for any future meeting, really, if you do it that way. Thank you.
Thank you. The next question was about productivity. Does working at home help with productivity? Does it make the complaints process quicker? Obviously, smart working has been available for a number of years, and I can't really say we've noticed any difference in respect of a complaint response, the timeliness of it. In an adult social care world, like I say, we are actually able to negotiate that complaint response time. It's different in children's, and I'll just obviously talk about that later. There was a question about cross-border complaints, and apparently Councillor Snape mentioned a case where someone had moved from Cheshire and how this was managed. And for us, it's according where, if a complaint came in, it'd be where that statutory duty sits, and where, and also around the ordinary residency. So therefore a case-by-case basis. So for example, if we had placed someone in a care home to be closer to their family, say that's in Cheshire, the statutory duty to provide actually sits with the county, with Staffordshire. We are paying that. If this person is perhaps has decided that they want to move to this care home, they are self-funders, that's an ordinary residency issue. So really it's on a case-by-case basis. And that was the end of my my list, but obviously happy to accept any others.
Thank you. Any further questions from anybody? I'll go back to Councillor McMahon, please, first.
Thank you. The issue from working from home wasn't so much the complaints procedure and the time that that took, but it's interesting looking at the nature of the complaints. You put in brackets in the inverted commas rather in the piece, delay in receiving seems to be a common theme, and it's delay in receiving the source of the provider, the assessments and the invoicing, the financial assessments and the invoicing. And it strikes me that both those departments, if you like, are able to work from home. And whether the poor communication that is highlighted in the report and the brokerage and finance services, which seem to get more complaints than others, is a feature of productivity, and whether that's impacted from working from home. Now, I say this not being critical of those who do work from home. There's a lot of work to suggest that people work harder working from home, but it's not clear that productivity is increased, because things like arranging meetings on Teams and all the rest of it, you can do it at a drop of a hat. And people could spend all day in meetings and then have to work in the evenings. Microsoft did a piece of work saying that 30% more people work in the evenings now when they work from home than they did before working from home. So it's a question of productivity, and it's a question of staff morale, I think. And I would just like a view on that. My second question, and then I'm done. My second question is adult learning disability preparing for adulthood. Now, it's small numbers. It goes from 7 to 11 or so. But preparing for adulthood, whether it be in the health system, the NHS, or whether it be in the local authorities, moving from a children's provision to adult provision is always tricky and always seems to trip us up. And I just wonder if there's any thoughts from Cabinet and the portfolio holder about how that could be, both portfolio holders indeed, about how that could be improved, and not just for adult learning disability, but other pieces of work where people have to move from being a child to being an adult, and the provision the consequence of that. I'm done now. Thank you.
Councillor Jessel, please.
Chairman. In terms of working from home and any impact on productivity, as Kate has said, there's no evidence in terms of these complaints. I think if that's something that is of an interest to Scrutiny, that would need to be the subject of investigation of a separate report, because working from home impacts on the whole of the local authority. There are some people who traditionally haven't come into the office every day. You know, I spent the afternoon with a social work team, and they're out and about all the time. So, you know, there's a lot of hybrid working that's been going on for a long time. And I think actually my perception is, and it's only my perception, is things have settled down now, and there's a good mix of working from home, working from the office, because people were missing the interaction with colleagues. As I say, yesterday I spent the afternoon with a social work and learning disabilities team, and they now work in the office on average 3 days a week, because they missed that opportunity to professionally exchange ideas, ask for advice. So I think things have come to an equilibrium now, but I think in terms of the impact of efficiency, I think this is rather outside the scope of this report and would need to be subject of a separate investigation. In terms of preparing for adulthood, I totally agree with Councillor McMahon, and it is something that Councillor Sutton and myself, with the two heads of service, Richard Harling and Neelam, I apologise to Neelam, I can never pronounce her surname. Everybody calls her Neelam, and she's quite happy with that. We had a meeting recently and agreed a way forward, because I totally agree with you. The sooner adult social services can interact with the younger person to have a properly planned transition, be that over a 2-year period ideally, that has to be, because there is a difference, there's quite a significant difference. And also I'm very keen that with young people we operate this strengths-based approach and actually help them to maximise their potential. There was a report that we discussed at informal cabinet which actually identified that we want to work more to help those people either become employed by the county council or other local employers, so that actually they can have a more fulfilling life. And I think that's quite a shift, but that has to be planned and worked with that individual, their families and their carers, because I think it is something we do need to improve on. Both of us are very keen to do that, and we've instigated that piece of work now. I don't know whether Councillor Sutton wishes to add.
Councillor Sutton, please.
Yeah, I mean, further to that, completely agree. And that transition from being a child to adult has always been a difficult area. One of the areas that we do have difficulty in is around special education needs and disabilities, and the fact that quite often those children are not on the radar of social workers as such, and quite often there's an expectation as a child that the parents will do lots of those things, but when they become an adult, there is no parental responsibility there, so they then suddenly end up in the adults world. And because we haven't been able to previously keep that data right and look to see who is likely to come forward, we've not been particularly, there's been a breakdown between the two. So part of what will be done is particularly around those. When it's down to children with complex needs, they're much easier to identify, and they actually should not really be any reason why we can't manage and work with them to make sure that transition into adulthood is right. But I don't think we've got that as right as we should have. And as Councillor Jessel has said, you know, we're absolutely working on that.
Kate, do you want to come back on that in any way? Okay. Councillor Janteglen, please.
Thank you, Chairman. I'm really pleased with this report. You know, your answers and the Cabinet members' answers have really brought a comfort to me to learn that this procedure is being looked at and trying to simplify it. I mean, we all know, though we're not all experts, few people are experts, to get onto a computer and find your way around it is awfully difficult. You do need to have someone with the knowledge that will be able to help you. So I'm really pleased that this is being looked at. And the other thing is, this cross-border was asked at the pre-meeting, so thank you very much about that. That's it. Thank you, Chair.
Thank you. Councillor Mike Wilcox, please.
Thank you, Chairman. Kate, just a couple of questions and some observations, really, just to try and understand the data that we've got in front of us. And clearly, we're in a world where complaining seems to be the top thing that people want to do if they don't get what they think perceived to be what they want. Just trying to understand the first contact team, in as much as the assessments that they completed at first contact. And obviously, in an ideal world, we'd like to see that increase because, as you rightly say, the more that we can do at first point of contact, the better it is for the system. In relation to the changes we're making to the financial information that we need, are we governed by legislation on certain information that we have to get from the customer, our residents, or is it down to us as a local authority to decide what we think is the information we need to make an assessment? That's the first question.
It'll be based on the Care Act.
Okay.
For both
Okay.
an assessment of need and a financial assessment.
Okay. The first contact team, are they empowered to sort of take on and make decisions that perhaps could be done rather than passing it on to a formal complaint or passing it on to the finance team? Because most of the complaints that seem to come in are around finance and the response that we get. And I just wonder whether if they're empowered to make more decisions or able to sort of give that information back to the customer rather than going through the finance team, would that reduce the amount of people that then automatically think, well, I'm going to complain, if they're given the information that actually would have come from any complaint that they made? That's the first part. Secondly, do we send out a holding response to our residents when they make an initial complaint to us? And do we set out guidelines of how quickly we are going to deal with that complaint? And if we can't and we need further time, do we sort of respond to the customers in doing that? And then I think, and then the other point with regard to the contact team, I imagine, and I've worked in an industry where I've worked in banking, I imagine if you have a contact team that on the whole work on their own and can at times get lots of abuse from people over the telephone, not getting the information they want, can be quite soul-destroying. And I know that when they work in a team where they can talk to their colleagues or bounce off ideas with their colleague, helps in that situation. And I just wonder what sort of care we're offering to those who are working at home, whether or not, you know, do we contact them regularly? Do we talk to them about the casework they're taking on, just to see what sort of days they've had, whether or not, you know, it's had any effect on them? So that's to start, Mr Chairman, if I can. Then I've got some others I'd like to come back to if I can.
Just to say that the first contact team deals with social care assessment, people that are requesting social care, adult social care assessment. They wouldn't deal with the invoice side of it. That would be the finance team. So the first contact team, as I say, deals with requests that come in from, for example, a GP saying, I've visited XYZ and I feel that they need contact from social care. Or they will look at reviews in respect of this person feels that they are already in receipt of but would need more information. As I understand it, they are staffed by social workers and social care assessors, so they have the relevant skills and knowledge to actually progress with anything that comes into them. The contact centre deals with all the other calls in respect of general inquiries, etc. And they are a corporate team that pick up a lot of issues throughout for the whole of the county council, not just social care. So I just thought it important to define that that's the first contact team do adult social care, the contact centre, the customer contact centre picks up any issues for the whole of the council, the whole of the services that the council provide. And of course, from an adult social care world, they wouldn't be covered in this annual report. They'd be covered in the corporate annual report that comes to corporate review. In respect of when a complaint comes in, if they email us, it's acknowledged automatically. If they write, we acknowledge receipt. And as I've said previously, we define a complaint, and that's our first contact with the complainant. They come back to say if they're happy or not, or we go back and ask for consent, etc., etc. So the communication is ongoing. We then send a letter out to say timescale, under what regulation it's been investigated, and also the actual complaints that have been defined and the investigating officer. The third issue was about abuse, and I know that as a council we take abuse towards our members of staff very seriously. I'm part of a group that looks at issues that come in from a frontline perspective as well, from a social care frontline perspective. There's myself, Kate Loder as County Manager, and the Health and Safety Manager, Becky Lee, and we look at these issues that come in and we ensure that our members of staff are appropriately supported.
Thanks for that, Kate. In relation to the financial services and the complaints in relation to that, are the complaints normally that the customers are not happy with the response that we've given in relation to financial services, or is it the fact that we've taken so long to get the assessment done and back to them that it sort of prolonged the experience going forward? And then secondly, Mr Chair, Councillor Jessup, you mentioned about changes you've made to the financial assessments and the information that you require, and a workshop happening in October. I wonder whether that workshop is open to members or whether that's just for officers. But secondly, members. Is it then, would we then have an opportunity, say 6 months down the line, to assess whether that has actually made any difference to the number of complaints that we've received on the financial services, rather than leaving a full 12 months and then going back and say, well, actually, doing this hasn't reduced in anything. It might have increased, hopefully not. But at least if we can have just not a full report, just an update, whether or not after 6 months it has actually made any difference to the number of people complaining in relation to financial services and the information that we're getting back from the residents.
Okay, can I ask, we are a scrutiny and overview committee, so it'll be our role to check and to make sure in the future that what we've discussed here, what we've recommended actually is being done. So that will be one of our roles.
Okay.
It's a thing we consider for our work list for later.
Okay.
To say it's for any scrutiny committee to request information such as that, whether it's this committee or because it's a financial procedures, it's corporate, that will perhaps be for others to determine. As I say, the issue, the difficulties arise in the fact that under the Care Act, if somebody is assessed as needing a service, that has to be provided as soon as practical. So often people have been in receipt of services for a number of weeks before the financial assessment can be done. So you're automatically, if you're deemed to have sufficient assets that you've got to contribute to that care, you can be several months in debt by the time that's sorted. Some people deliberately delay sending in the relevant information. Some people find it quite onerous because the amount of information we've requested in the past has been, somewhat bureaucratic. So we're reducing the amount of information we require so that actually it can be easier and quicker and less opportunity for deliberate delay for people to send those assessments. The other thing that we're looking to do, and I think the social work teams are now expressing this to potential recipients of carers is actually to turn the system a little bit on its head and say, Mrs. Brown, you need 2 visits a day. The cost of this will be X, but if you can get your financial information to us quickly, the chances are the local authority will pay a contribution to it, or you may not have to. So that actually people are flagged up at the first point that actually there is a cost to this, but that actually the sooner they can get their financial information in, the sooner the contribution from the local authority, if that's deemed appropriate, can be paid. So I think one of the difficulties is where you get people who get an invoice, their first invoice, but they've been receiving the service for 4 months. And that can be a significant sum of money and a significant worry for people. So it's having that slightly different approach, and the informal feedback I've had from social workers has said it actually is making the conversation easier, because people like to know up front. But as I say, whether that financial process, I mean, certainly I and Councillor Parry will be keeping an eye on this, but I suspect it's probably corporate overview and scrutiny who may wish to take that up.
Thank you. The more incentives we can give our residents, our service users, to get matters in, the quicker the better. It saves us money in the long run. It saves heartache for them, whatever it's going to be. But the first part of your question, we'll refer it now to the corporate complaints, corporate complaints, to the Corporate Overview and Scrutiny Committee, which meets on the 12th of September, and see if we can get response from them on that matter. That's if they wish to look at it. Councillor McMahon, please.
I'm heartened that frontline workers are having financial conversations. I expect that social workers and social care workers are very similar to clinicians. They find talking about money with folk difficult, and I think often they're not particularly good at it. And I just wonder if there's any training for that. That's the first thing. And also, to protect the county council's position, how well documented that discussion is. Now, clearly, the clinical side of it is what they're used to documenting, and that'll be straightforward. But I think it's important that they document they've had that financial discussion, and they also document what the response was like, in order to protect the county's position.
This became a theme last year in respect of we're having a lot of people saying we were not told that we got to contribute or pay full costs for our care. And a piece of work was done by Nick Bowyer in respect of practice, and there is a part on Care Director that has to be filled in now, advising that this is what has been said. There is a plan moving forward that we ask the service user to actually sign to say that that conversation's been had, and then that will be put on Care Director. But and training has been given to frontline adult social care colleagues in respect of that, and we've seen a reduction in those complaints. Councillor Wilcox asked for the reasons around finance, and the majority are about the delay in receiving. You know, we shouldn't be putting people in debt. We shouldn't be putting our citizens in debt. And the other thing is if they are full cost, there's an admin fee if we arrange the care for them. And a lot of complaints were talking about, well, I've not been told about this £400 admin fee. And of course, that brings in Councillor McMark's concern about how do we record that, and that's recorded on Care Director too.
Thank you for everybody. Compliments, 68. Nobody's mentioned compliments. It's not just but we get complaints, we get some nice compliments as well. But just in summing up really, I've referred a few matters to Kate, as Kate knows, over the last 6 years. And one of the biggest things has been communications. Myself and Councillor Sutton work for a big organisation as Councillor McMahon, Councillor Wilcox, as we all have. And communications in big organisations is often a problem. We think people have understood something that we've said, and many times they haven't. Communicate is a two-way thing. And it's really how we check that what we've said is the way it's been received. Often we'll say something, even just among ourselves, we'll say something, and people look at us. But if they're on the end of the phone, we don't get that reaction sort of thing. So really, it is about asking questions and getting things right. Okay, final question. Okay.
Thank you. Just I wanted to come on to the compliments because they're really important. And I'm sure we share that with the team. And I'm sure we look at the information in the compliments to see if there's any lessons that we can learn, any practices we can put in place to sort of increase that. But I just want to be reassured that members that have compliments made to them are shared widely and sort of acknowledged by the team.
Yes, compliments are very important, especially in respect to frontline services. You know, you could be, you know, you have, emotionally you go through a lot as a frontline social worker, don't you? So yes, it's very important. We do share with them and we celebrate them as well. It's good that the Health and Care Senior Leadership team also celebrate them too, which is very good practice. It shows that obviously we understand what they're going through and we're happy to share the good as well as the bad.
Before calling Councillor Jessel for the final comments, can you please take our thanks back to all the team really, and Councillor Jessel as well. You do such a difficult job in difficult circumstances. Yes, there are a lot of complaints, but we are trying to sort those out. And as Councillor Jessel says, if we didn't get complaints, then we'd wonder what we were doing wrong, really. At least now we know what we're doing wrong. We are trying to amend all that. So thank you to everybody, really, who works as part of our social service team. And the people who actually take the complaints at various times. It's not easy because you're working against sometimes your own colleagues, and it's always a difficult thing to do. So I'll finish with Councillor Jessel just before I address again.
Yes, thank you very much, Chairman, and thank you very much for those comments. And can I assure you that as Cabinet Member, I take every opportunity I can to recognise the work that our staff and all the care workers out there do. And you've heard me in full council, and I don't apologise for the fact that it may sound boring to you, but I think it's important. You know, there are a lot of people who work in the care industry as a whole. It's not easy. Some are absolutely brilliant. There are always, we're all human beings, that some are perhaps not as good as they could be. But in terms of our staff, every year at Christmas time, I send an email to all of them in recognition of the professionalism, the commitment, and the fact that so many people do rely on them to do the best that they can. You know, it is important when you've got a difficult job, you're, you know, visiting people's homes who are not always terribly cooperative. You're trying to do your best. And I think, I mean, I know when I've worked for organisations, that recognition, even be it small, actually means a lot to a lot of people. Thank you, Chairman.
Thank you. We had the report for noting. We've asked questions on it. Do we accept the report? Thank you. When we come to the work programme later, we'll go through any items we need to that we may want to add to the report. So can I thank Councillor Jessel and can I thank Kate for that part of the report? Thank you. To item 5, Customer Feedback and Complaints Service, Children's Social Care Annual Report 2022-23. Councillor Mark Sutton, please.
Thank you, Mr. Chairman. And I'll make the introduction relatively short, mainly because the rationale behind having to do this was explained by Councillor Jessel for the adults, and the rationale's really no particular difficulty. I think being able to look at complaints and compliments by the service, and I know that complaints work very well with the social workers on the ground to ascertain what's going on, so that we are able to benefit from the complaints that are made and the compliments to see on the ground, you know, what might be going wrong and what might need to be improved, and likewise, actually, what's going right, and to be able to feed that back to staff. And you will see from the report the headlines, and there's no getting away from it, there's no hiding from it, the fact that the actual physical number of complaints has risen from 2021-22 to the year for which this is the following year, 2023. That's absolutely clear within the report. What I do think is beneficial within the report is the fact that actually it's also now broken down by districts. Not necessarily to identify one district bad, another district good, but from the perspective that as now in all districts we have a district lead that has responsibility around just for that district. That gives that individual the opportunity, I think, to better understand what's going on there and to be able to address those issues and link that also, I think, with any issues there already is around maybe the practice being good, bad, and then when the district leads meet together to discuss these things, they can all learn from each other. I think that's a particularly good level in that management in the management system, because it gives those individuals own ownership over their area and gives them opportunity also to work with partners across that district. Haven't got anything else particularly to say at this moment, so if it's okay with yourself, I'll hand over to Kate.
This is the first annual report since Children's Transformation took place, which was not November, it was the November the year before. And as Councillor Sutton has explained, the decision was taken that the services would be district-led. So this includes children's social care services plus SEND. But unfortunately, they have to be dealt with via two different processes. The children's statutory complaint regulations are a three-stage process, which is local resolution at stage 1, independent investigation at stage 2, and an independent panel at stage 3. Obviously, that's long and lengthy, and we do our utmost to try and resolve at stage 1. Again, as I explained earlier, the complaint comes in, it's defined, can we resolve it before it goes into the process? The stage 1 process is 10 to 20 working days, and whether that's upheld or not, the complainant has the right to escalate to an independent investigation called a stage 2. And at that point, the complaints team and the district lead get involved to see if we can provide resolution before we go into stage 2. Because stage 2 is 65 working days. So therefore, you've got a very emotional situation ongoing where there's no resolution. We have complainants not wishing to sign documents because they've got a complaint ongoing, etc., etc. So we do our utmost not to do that. Once we get to the end of the 65 working days, there is a report, an independent report. It could be before then, sorry, I'm not, it could be before then, with a recommendation. And again, if the complainant is unhappy, whether it's been upheld or not, they can go to stage 3. And again, we do our best to resolve, but we have no power to say no. The Ombudsman brings us to task if we say, you can't do that because everything's been upheld. It's the process, and they need to get to the end of that process before they go to the Ombudsman. As you can see, statutory stage 1's up 56% from 92 to 142. And then our stage 2's from 6 to 13, and our stage 3's remained. Now, whilst we can say and work with a complainant in respect of stage 2, we'll go through the mediation, and at the end, if they say no, I'm still not happy, we still have to go to the stage 2. So we can do our work, and as Councillor Sutton said, work very closely with the district leads, but we don't have the power to say no. So that's the statutory regulations. SEND comes under the corporate regulations, the corporate complaints regulations, mainly because they're nothing to do with adult social care. And that's a two-stage process in respect of, we say it's do it once, do it right, so that complaint needs to be thorough, but we give the complainant the opportunity to come back and say, no, I'm not happy with that. But they have to say why. Because if we've answered everything and it's a full response, if they can't say why, just being unhappy with the outcome isn't good enough, we say, I'm sorry, that's our part concluded, and off you go to the Ombudsman. As you can see, there has been a high increase in respect of stage ones, and these are mainly about or around the SEND offer, or the fact that we feel that their child or a complainant's child isn't eligible for an EHCP. And as you can see, the stage 2s have gone down. So for me, you do look and think that our complaint handling is better at stage 1 corporately than it was previously. Again, we pick up duty issues, 199. We have a lot of MP inquiries. If any of you were at the elected member training a few weeks ago, I think we have over 700 MP inquiries a year. So we do have those as well. LGO have gone up as well because both stat and corporate can go, and compliments remain the same. It doesn't look a positive report, and I think for the first year it's been hard because we've had SEND going into the districts, so within a social care environment. We've had a high turnover of staff for the children's transformation, so therefore we've had to work in respect of training. We've had staff trying to respond to complaints that they have no knowledge of the service. So therefore, there's had to be a quick catch-up in respect of ensuring that the staff are appropriately supported when responding to a complaint. We've brought in QA for both services. It used to be just for our statutory colleagues to enable us to assist in respect of stage 2, but we've brought that in respect of SEND, our corporate offer as well. So the information is district-based, and hopefully that's helpful for you. I think it's important to see the overall picture and acknowledge that they've worked hard from a complaint perspective to ensure compliance with our regulations. But of course, if you've got a key worker sitting within a district team that's got a caseload of 125, complaints aren't always going to be their priority. So therefore, that's where our support mechanism comes in to assist. I hope that helps. Obviously, there's a lot of information there. And of course, I've got questions, but I didn't know if anybody wanted to ask those questions first.
If I just say to Kate, if the question doesn't come, if you want to then play afterwards, okay.
Thank you, Chair. Thank you, Kate. On page 62, it mentions professional curiosity, and we all know that when there are case reviews of horrific cases where children have been killed, that one of the issues that's always raised is our social workers lacking professional curiosity. And my heart sank when we're also being told that it's also been highlighted that there are some team managers who also lack some professional curiosity. And part of me thought, well, how high up does up the professional scale does that go? And some reassurance, please, that this new process that has been introduced will mean that that'll play a major part in reducing some of the horrible child deaths that we've heard of when it's been an almost, to an outsider, a straightforward issue of if the mother has said, my child is stick thin because they've got a certain illness, not double checking with the GP that somehow that doesn't sound right. Something as simple as that. Thank you, Chair.
I must apologise, I can't find the reference to this. I'm not sure which. My page 62 doesn't seem to have any reference to this at all.
Page 62.
Page 66 of the report, page 62 of the document. It's a central paragraph on that page.
Yeah.
The actual recommendation came from a stage 2 investigation.
Okay.
And therefore, we ensured we have, again, a good working relationship with SLT, with Family and Communities SLT, and also Nisha, who's the Assistant Director for Social Care, to ensure that these recommendations are implemented. And it was implemented to ensure across the board that, you know, professional curiosity is a main role within. I can't add any more apart from that. I'm not sure if Councillor Sutton can.
I mean, just from my point, professional curiosity is lived experience, learned experience. Yeah. If you don't know about something, it is difficult to answer a question like that, really. If somebody gives a reason, okay, perhaps you might be able to answer time, but you can go back and ask questions, and I hope that's what we're going to learn from for the future, really. Mark?
I mean, consistency of practice, and I think this relates a little bit to that, is particularly important. And, you know, without knowing the actual physical details of this case, it's very difficult in 4 lines to understand exactly what that case and that matter was all about, and actually at what level that professional curiosity and wasn't challenged apparently by team managers was, and whether this was an isolated case or this was a series of cases that made us enter that in there. So I don't know those specific details, but what I would say is that professional curiosity, both by social workers on the ground and then by their managers, is absolutely a really important, but very difficult for me to comment specifically on this without knowing the details of the individual case.
Sorry, Chair, maybe I didn't explain myself properly. With respect to Councillor Sutton, it's not at times a case of knowing the details of what's been going on. It's just that emphasis on if it doesn't feel right, if your gut feeling is, and it doesn't matter if you're 15 or 55 or whatever, if your gut feeling says, hang on, there's something not quite right, it's as simple as double check it. Check it out if that is the case. Yeah, thank you, Chair.
And having personally been to endless matters where I got a gut feeling, whether this was right, wrong or indifferent, you know, I would absolutely concur with what the councillor has said, that you then double check. What I can't say is whether that is the issue here or not.
Thank you. Councillor McMahon, please.
I think a gut feeling comes with experience, and keeping experienced social workers and people who look after children as much as we possibly can, I think is really quite important. My question is, I'm a real fan of the Children's Transformation Programme. I think in time it's going to really deliver. But any transition leads to difficulties. We all know that. And that might in part be a reason why these numbers have increased a bit. But also the Children's Transformation Programme it was announced with bells and whistles, in my view, in the sense that everybody thought this is the answer, this is what's going to deliver. And I just wonder if that's fed through the system and whether part of these complaints is that we're overpromising and under-delivering. Now, I could be talking absolute nonsense, but I think that's something that as a portfolio holder, you have to ask yourself that question just to make sure it's not the case.
I think looking at these figures is, you know, what we also have to appreciate, and it hasn't necessarily been mentioned, is the impact that COVID might have had on previously during that, whether people thought, well, everybody's busy, there's no point in making a complaint, I don't do it. As we've moved out of COVID, maybe people are more likely. I don't know. I'm just potentially surmising. So I think it's quite difficult. And as was pointed out, you know, this is the first report since transformation. So we're not necessarily comparing a system that's fully working with another system that was fully working. But I take very much on board the fact that the transformation, yes, it put us into a position where the system we had then, I absolutely fundamentally believe is right. However, there are issues that need addressing. New people come into post, and I think as we go forward now, it is about getting all the small parts of the whole system working as well as we physically can going forward, and that would include things that have been highlighted and fed into it from complaints and from compliments as well. Are we over-promising, under-delivering? Depends what you mean by who we are over-promising to. The bottom line is we want to ensure that children in this county are as safe as is possible. That's what we want. But also we have to make sure that we are working with families, and part of the process was to work with families in a different way, using restorative practice, strength-based, as was mentioned by Councillor Jessel earlier. And those things will take a little bit of time to implement across the whole of the system. We now have a complete complement of district leads, our workforce programme to make sure that we have more of our own social workers and less agency staff is slowly starting to take place, and that is far more stability than there was just after transformation, because transformation happened just after COVID, and we also have to realise that lots of individuals, experienced staff, and not just in children's social care, but across the board, have taken the opportunity to change their lifestyle and not be in the workforce. There probably isn't an industry in this country that isn't looking to recruit at this moment in time and having difficulties, you know. And the children's social care world is no different. But we have been working really hard with HR, with lots of different programs, and together with adult social care to improve our offer around the social care workforce. And that's not necessarily financial, but making it more attractive in many other ways to come and work at Staffordshire and stay here.
I'm told that's also a matter that the Health Scrutiny Committee is looking at, so they will be coming back from a different angle perhaps in the future. COVID made such a difference really as we started it all, so I think really it's a case of going through this year. We will keep looking at from our point of view as a committee and waiting for the next report really in 12 months' time. Councillor Jant-Eaglen, please.
Do we, I'm just curious, do we ever do any benchmarking with other councils?
Yes, we do. I can't do it until after the report's been signed off because I can't share the report. But yes, we do. We do benchmarking and part of the regional complaints manager group and also the national complaints manager group.
That's fine. So we just want the best for the best. So to compare with other councils, it's just a good marker.
Thank you, Chairman. Whilst it's obviously disappointing to see the number of complaints go up, equally we should actually be celebrating that the number of compliments are almost half as many as we have those that make complaints. And then, just a question here, Kate, if 1 in 3 of the complaints in stage 1 are upheld, and almost 1 in 3 are not upheld, are the people that complaints are not upheld still able to take it to stage 2, even if it's not upheld at stage 1, please?
From a statutory perspective, we can't say no to stage 2. From a corporate perspective, if we have fully responded to their concern and it's not been upheld, we have the opportunity to say, no, we can't do any more, off you go to the Ombudsman.
Kate, is there anything else you want to update the committee on? That's any previous questions, especially by the chairman?
The previous questions were very much like the adult social care. There was a question about external, and I think I answered that in respect of, SEND have come into the districts and therefore, we've had to support more than we would. But apart from that, I think it's important to say on the back of Councillor Sutton talking about reporting, and we are part of the reporting. We are invited to provide quarterly reports in respect of complaints. And of course, lessons learned are very important, whatever we do. And they are taken on board by Nisha and obviously Neelam in respect of ensuring that we do learn lessons from the complaints that come in.
Thank you. In sum up, can I first of all thank Councillor Sutton, the Cabinet lead on this, Kate Boulevant, the Complaints Manager. It's an excellent report. It's warts and all, the best way to put it really, the good points and the bad points. As a committee, can the report has been presented to us, can we accept it? Thank you very much. To the 2 Cabinet members and to Kate, thank you very much for spending the morning with us. We've learned so much about what's going on, and let's have a great year and let's see how it goes in the next 12 months. Councillor Sutton?
Yeah, thank you for that, Mr. Chairman. Do you want me to stay for the last item? Yeah. Yeah.
You are now taking his portfolio.
Jonathan, knowing I was coming, did say, would you try and cover it?
Welcome, both of you. Just to introduce the item. PSHE coordinate impact, personal, social, health, economic. Presentation by Mr Phil Pusey, Chief Executive of Staffordshire Council for Voluntary Youth Services, Skivvies. Over to you, Phil.
Thank you, Chair.
And just to say, we've also got Natalie with us. Thank you.
Yes, I was just going to introduce Natalie as well. Thank you. It's interesting, it's been a year or 2 since I was in front of a scrutiny committee. So I wasn't quite sure how many of the councillors I would remember, but it's nice to see some friendly faces. So for those of you that don't know, me and Skivvies as an organisation, I suppose just a very quick overview before we focus on the education service. Skivvies has been a strategic partner for the County Council since 2016, particularly in its relations to children, young people, voluntary sector. So it's reassuring to hear positive sounds about the children's transformation, which obviously we were involved in, and the youth transformation prior to that. Very quickly, 3 areas of main work that we undertake. One is around capacity building for the sector, so that's 200 plus voluntary organisations delivering to 35,000 children and young people on a week-by-week basis. We try and help those groups to be safe, strong and sustainable in everything that they do. that then improves the offer around informal education and personal social development for our children and young people in the county. We also have a team focused around youth engagement and youth voice, capturing that and feeding that up into various strategic boards. And then we have our PSHE coordination service, which Natalie is not just the lead for, but the sum of the resource available to support Staffordshire. So just a little bit of context in terms of PSHE. It was around 2018, I think, that the Staffordshire Commissioner's Office started to ask questions and got information and intelligence around the need for improved personal, social, health, economic education across our schools. Some schools and colleges do this exceptionally well, others less so, and the need was for just improved consistency and quality. And so the started to look at how we could do that without having a massive amount of resource to be able to do it. The Commissioner's Office sought partnership buy-in, which happened at various groups, including the Early Help Board and a few other places, Family Strategic Partnership. They found some funding and allocated some funding, and they sought a suitable organisation to host that post, as they described it. Stoke were a little bit ahead of us, so they quickly identified a host organisation, which was one of the school academies. So they appointed a coordinator in, I think it was September 2021. 2020. So they had a post holder for a year while Staffordshire was still trying to identify a host organisation. We must have missed it when it came out, but I think after a little bit of a think, we saw potential links between informal education, which is our business and what our member organisations deliver, and formal education, and maybe a direction of travel nationally since youth work came out of the DFE, that actually these two were not as operating as closely or as in such an aligned and informed way as perhaps they could be. So we spoke to the Commissioner's Office and said, yeah, happy to host this, and let's get cracking in Staffordshire. The post holder in Stoke only lasted 12 months, unfortunately, or fortunately, depending on what's happened, because we've ended up with a dynamic duo of Natalie in Staffordshire and Ellie in Stoke, but they're very much working as a team. So they're doing the same role, but they are able to divide the tasks so that one of them will do the task for both areas, which I think is a brilliant use of resources and making sure that we maximise the impact of the service. So we've been going since December 2021. There's a multi-agency steering group that kind of oversees it and ensures that what the PSHE service is doing is connected into everything else that's happening in that system. So you've got police engagement there, drug and alcohol service, children's services, early help, all of those kind of organisations are represented there. So in terms of the detail, Natalie is the expert, so I'm going to shut up and hand over to her to talk you through the first 18 months or so of the service.
Thank you, Phil. So personal, social, health and economic education, or PSHE, and I always feel like I have to just say what PSHE stands for because obviously my job title is PSHE coordinator. It's a curriculum subject that is taught both within formal education and informal settings. Since September 2020, there are statutory requirements for schools and colleges that the Department for Education has set out. These are around relationships and health education for our primary age children, and relationship, sex and health education for our 11 to 16-year-olds. You are probably all aware there is a national review currently being taken place through Westminster. So at the end of our year one, we produced an impact report. If you haven't already read it, then I would strongly encourage you to do so. And this details the activities, outcomes and impact of the first year of our service. And provides specific case studies of work that we've achieved in the first year. In page 10, you'll see this diagram, which is the overview of our support and advice and guidance element of the work. And I'd just like to take a few moments just to kind of explain how and what that means to education providers. So the PSHE Digest is a monthly newsletter that gives information about resources, research, training opportunities and updates from both local and national partners. This includes signposting information, so if somebody's changed their form, telephone number, we're able to get that information into all education settings through that monthly newsletter. We also have PSHE Leads meetings. These are half-termly meetings that focus on different aspects of PSHE best practice. And they give PSHE leads a safe space to share their challenges, ideas, and to meet people in similar positions across both Stoke and Staffordshire, because it can be very isolating being the PSHE lead in one school. We also run PSHE bite-sized practice development sessions. These are monthly meetings that run term time only to support anyone who delivers PSHE education to increase their knowledge and confidence. It's one of the things that was identified through national reports is that children and young people recognise when the professional, the facilitator in the room doesn't know about the subject or doesn't want to be teaching about the subject. So we wanted to address that by bringing in subject experts, and I'll talk a bit more about that later. We also have our And PSHE series, so there are 88 topics that an effective PSHE curriculum will cover from the ages of 5 to 16. We can't expect education or youth organisations to be experts in all of them. So what we do is we pull together the learning objectives and best practice, and again I'll talk about that shortly. And we have best practice guides to give information to advise and guide education providers in implementing best practice in their own settings. So we're very much about empowering people to bring in that consistency and that quality in their own settings. So in April of this year, we launched our own website. So it's pshestaffs.com. We like to keep things as simple as possible. And again, I'd encourage you to have a look at this website. In relation to how we support education providers, this is our central resource library. So our education providers sign up for this. This bit's behind a membership wall, and they can click on the topic that they want to look at, and then there are quality assured resources that have either been nationally sourced or locally produced. So instead of having 400 PSHE leads all having to go out and find resources, we've got this one central place, which means they can then focus on either training their staff or dealing with that more local need that they may have in their school or youth organisation. So since April, we've had 210 users sign up for the resource library, of which over 65% have links with the county, either as a partner, external provider or education provider. As well as linking to resources from the public domain, as I say, we've also put in the And PSHE pack. So when you click on the topic, the first thing that you will see, or we'll see once we finish them all, is that link to the curriculum and to guidance to help you to be able to meet those learning outcomes. And I've just put on here a couple of quotes that people have said about the website just to draw your attention to. We also have our previous digests are on there, webinar recordings. These were previously shared through Google Drive, and it wasn't possible for us to track engagement. We now have our own YouTube channel, so we're able to see those people who don't necessarily come to the live recordings of the session, that we can see who is viewing our webinars and making sure that they are useful. So probably the most thing that we're best known for is the PSHE Digest. And as mentioned previously, this is a monthly newsletter. At present, we have 686 individuals that receive the monthly newsletter within Staffordshire. So this excludes those who receive it through Stoke. We have 2 versions. They are very similar, but the local updates reflect the area that we're covering. If anybody wants to be on the mailing list to receive this, then please feel free to let me know, and I'm happy to share it with you. We get fantastic feedback from education providers about the quality of information resources. And again, I've just pulled out a quote from a secondary school in Stafford. So you can see not only are people using the thing, but we're actually influencing the curriculum as well, which is brilliant. So one key outcome for the PSHE Education Service is to support the development of consistent quality, age-appropriate PSHE provision. And again, as I said earlier, we achieve this by empowering educators with the knowledge of evidence-based best practice principles. In the first 18 months, we've created 5 best practice guides that you can see on the screen. And we've also hosted 7 bite-sized practice development sessions. This is where we work with the subject specialists who'll speak on the topic and how it links to best practice PSHE. And provides information on local signposting, information and details of referral pathways and support available. So this academic year, we've hosted webinars with Stoke City Council Community Cohesion Team to explore extremism and prevent, United Staffordshire Against Hate to look at homophobia and hate crime, Catch 22 to look at child exploitation, Action for Children for mental health, MPFT for sexual health, T3 and CDAS for substances, and this month we had New Era in to look at domestic abuse. 96% of people who completed an evaluation form rated the session as either excellent or very good, and 94% said they would recommend the sessions to their colleagues. Another key outcome for the service is to support the delivery of consistent, quality, age-appropriate PSHE. So, as I said earlier, we do have the resource library, which supports them to access resources. We've created a local quality assurance framework, which is referenced in the Quality Assurance Best Practice Guidance. And to ensure professionals feel confident, we've established the PSHE packs, as I mentioned. So we've created 13 packs to date, including on knife crime, oral health, sexualised behaviour, and water safety. So that's just 4 of the 13. I can share more details if anyone's interested. So these packs show the learning outcomes of both statutory and best practice for both formal and informal education, and knowledge to enable professionals delivering that PSHE education to confidently meet the learning outcomes and facilitate sessions, including information around safeguarding, signposting and referral processes. We've also been supporting Staffordshire Police to develop a standardised education package, which PCSOs will be delivering in the classroom. Staffordshire Police have 17 strands of vulnerabilities to ensure effective safeguarding for adults and children across Pan Staffordshire. Excuse me. These strands have been mapped to the PSHE curriculum learning outcomes, and from that we've developed a 5-session education package which cover all phases of education. And PCSOs in each local policing team will be offering these from September. So we wrote a guidance document for Staffordshire Police, which was based on national best practice from the PSHE Association and the National Police Chief Councils. But we localised it so that we were referencing our own priorities, and that in turn was placed into training, and the packages have all been sent through the Child Protection Governance for sign-off. We've also drafted scripts to support Staffordshire Police, to support Staffordshire Fire and Rescue Safe and Sound Virtual Education for Digital Blade Intensification Week, and we had a meeting yesterday with Staffordshire Fire and Rescue Service to look at how we can best support them as they develop Safe and Sound and their in-classroom education packages for this forthcoming academic year. We've created resources to support safe streets funding, and to address local needs. This is just one of our packs around safer sleep that came out from a review from the Safeguarding Board. We were then asked what could we do, so we've created a Key Stage 4 and a Key Stage a primary assembly package so that we were able to address that need, and we're also working with local authorities to address education awareness around youth homelessness. So as well as the education element of the service, the PSHE service also works closely with partners to ensure we have that true multi-agency approach. On screen, we've shared some of the local strategies and action plan that feature PSHE education, so you can see it is a key action point in many plans, both at a district and borough level, but also at county too, and Pan Staffordshire. And the next couple of slides just show information lifted from a page with the impact report that shares feedback from partners that we've worked with to show their experience. So again, you can see the positive working relationships that we do have. So if anyone has any questions or would like to link in with the service, our details are on the screen, and we'll now take any comments and questions.
Mark, do you want to say anything first, or do you want me to go to questions? Okay. Councillor McMahon then, please.
Thank you. That was pretty quick and very comprehensive.
Pretty good.
It was good. It strikes me that the bulk of what you do is there to protect children from threats. That seems to be the direction, which is excellent. The risk, to my mind, is that is that kids will see nothing but threats out there when actually there's huge opportunities as well. And I was going to ask the question, and I don't know whether this sits with you or with formal education in schools or whatever, who deals with work experience? How does that work? What about sport? Getting people, engaged in sport. There'll be far more than this. I've only got 3 written down. And the other is just basic skills like learning to cook. There's more and more evidence that ultra-processed food is doing us a huge amount of harm. There was a panorama on that recently, you may have seen. And we need to equip kids with a means by which they won't. Now, maybe you did cover it and I missed it, forgive me. But I just wonder whether, because we don't want kids to come away thinking they're equipped to deal with threats, but that's all there is in the world, when actually there's huge opportunities as well. And in terms of threats, did you do anything on online threats? Okay. In which case I missed that, my apologies.
I was really conscious of the time that we had, so I was just giving snapshots. So as I say, the 88 topics within an effective PSHE curriculum, they do cover being healthy, sun safety, online safety, mental health, vaccinations. So there is first aid, there is a full spectrum. Effective PSHE covers will have learning outcomes that should impact children and young people gaining knowledge, developing skills, but also exploring their values and attributes. So we make sure that in all of our best practice that we're reminding education staff about that. In terms of the work experience, for secondary schools, we're starting to develop a relationship with the Staffordshire and Stoke-on-Trent Careers Hub. So Phil's put us in contact with them and we're developing that. They're currently looking at their primary offer, so we've got a meeting hopefully during the summer to look at how we can more collaboratively work together. But we do things around food safety and cooking as well, so it's not just all threats.
Appears to be nationally a real disconnect between qualifications that children get and being work ready. There's a real disconnect there. And it's the informal stuff, exactly your pitch, where that could really make a difference. Thank you.
Yeah, just one addition to what Natalie said. I guess because the funding's come from the Police and Crime Commissioner's office, there is a sense that safety is higher on their priority. So there is a nudge for the PSHE coordinators to potentially focus on those areas. But I think what we've done is also push back and try to ensure that we're not just looking at that, because that is probably a quarter, as you say, of the PSHE curriculum. And there's a whole lot of other stuff that's very positive and very strengths-based that we would want to, and health-focused, for example, that we would want to help schools to deliver better and more consistently.
Just to take Johnny's question one stage further before you come back, Johnny. Do you feel we may be frightening people by what's being put in that? It's, as I say, it's all negative, or coming across to me as all negative, like as a retired police officer. Little positive, like people perhaps all the knife danger, all the prevent danger, so I better carry a weapon just in case. That was what was sort of going through my mind. I was listening to it. I know it was a speed presentation, so we got it all in, but that's what came across to me, listen to it. I'm a school governor in 2 schools as well, so I'll ask a question about that later though.
So we very much, in best practice PSHE, we're looking at the positives, so we don't use shock and fear tactics. So one of the big pieces of work we've done with Staffordshire Police is and it's a culture change for them, is the removal of showing images, be that road traffic collisions, knife injuries maintained during knife attacks. So they've all now gone. Again, that's a consistent message that we give. I think the topics might come across as threats and negative, but it's the way that things are delivered. So what it's about is about young people having the opportunity to think about their own lives. So we do a lot of distance learning and what might this be to this character, or what might happen, what might you do in this scenario, but then it's about bringing it back to their own perspective. So yes, the topics are quite hard, complex, and may seem as threats, but what we're trying to do is enable children and young people to then develop that resilience, but also to challenge misconceptions, those perceived social norms that, you know, young people are all carrying knives. So you may have heard of an external provider that a few of our districts and boroughs have funded through the Community Safety Partnerships, Alison Cope. So she is a mother of, from Birmingham, and her son was murdered through a knife attack. She goes into our schools, but what we've done and tells this tells her personal lived experience, and it's very emotive. What Ellie and I have done at the back of that is said, actually, there's more that needs to be done on this. There needs to be a place where children and young people can unpack how they were left, how they were feeling, but also to challenge that scaredness of, like, you know, oh, this is what's going to happen to me. So we actually wrote a second package, and what we say to schools is, if we're going to fund this through the Community Safety Partnerships, you have to do both parts of the session. So you have Alison come in and do her part, but then you also have this session which looks at conflict resolution skills. It's a skill we've lost as society. So we give them scenarios, and how could these people sort out, to use young people's terms, their beef. So that we're able to give them real skills that they're able to take out. So if we talk about the police sessions that we've created, the first session we do is People Who Keep Me Safe with our year ones. So they're looking at the role of the police, because how many of you have heard a parent or carer say, be good or the police will take you away? You know, we need to challenge that. That's not what the police are there for. So that's the first thing. It's about building that relationship right early on. We then come back to them when they are 9 or 10, so year 5, and we talk about keeping safe, so managing risks, because we know that teenage brain development is going to start at that point with puberty, so they're going to get that bit more independence. So how do we get them to look at online and offline life and think about their risk management, so they're able to look at a risk, assess it, and then mitigate it so that they can live as safely as they possibly can do. We then move into secondary phase education with our 11 to 12-year-olds, where we look at healthy relationships. So they're forming new relationships for a lot of them at this point in their life. So, you know, what does a healthy relationship look like? What's their values about relationships? Year 8, we are looking at exploitation. So again, building from those things we've learned about that. So again, we're trying to get young people to think about being a good friend, because that's, if you look at their fear of influences, being a good friend is the most important thing to them. And then we end the packages with year 9, so our 13 and 14-year-olds, where we look at knife crime, and that's because of, and I know that one does feel very threat, but that's because it's a police package. If we look at other work that we're doing, violence against women and girls, we look at bullying, photo sharing. So these are lived experiences that our children and young people will face, but how do we equip them with the skills to be able to decide what it is they want to do with their life, and to make healthy choices, or to make choices, because for some young people, they've never had to make a choice before. So suddenly, we want them to learn that how to make those decision-making skills, so that they're not faced in the heat of a moment with, oh, what do I do?
It just might be worth reminding Ben, though he hardly needs reminded, that those who are in gainful employment are far less likely to find themselves in the criminal justice system in the future. Thank you.
Just to say, PSHE doesn't cover careers. so I take your point, but it doesn't fall within my remit. It's one of those where we have a touching point, but that careers thing we need to work with Staffordshire and Stoke Careers Hub, because that's their interest, their priority.
Thank you, Chairman, and thank you for the excellent presentation, really good. I'm keen to explore the relationship that you have with the district and boroughs and how that can be enhanced or improved. And secondly, you may well be aware that in Lichfield we've had the Knife Angel for the last month, and I just wondered how that has been played out within your organisation, and how you've managed, or if you've managed to be able to inform all the schools and all the children. We've obviously had lots of schools involved, but I just wanted to make sure that you as an organisation knew that was happening and were able to play into it. Those are the two things really, Mr. Chairman. But certainly on the local authorities, is there any more we could do to help you? And maybe even having this type of presentation delivered to local authorities in their own setting might well be a way forward to, or you sort of get you sort of perhaps more well known. You seem to be doing a lot of stuff there, an awful lot of stuff there, and it needs to be shared more widely, I think.
Thank you, absolutely. So this is what we did for Lichfield. So yes, we will work very well. We've worked really closely with Yvonne and Stuart. And again, just to place our thanks to them, because they could have done it without us. but they wanted us involved. So we created a guide for education settings, which included information of how to make bookings, and I know they've had over 30 settings come and over 1,000 children and young people engaged when I spoke to them on Monday when I saw her. So we gave them some infographics so they could see bookings, but we also gave them some education, so if they couldn't visit, there were things that they could do as well. So we've got pledges. You might have seen some of these are actually attached to the Knife Angel now, so that we were very much through the digest and through the relationships we have with schools, we were very much involved, and I'm actually there both days this weekend to do the youth awards for the competitions, but also the civic departure event, and you can see there's all the events. Skivvies were also linked into that, so again, because we have different strands of the organisation, I worked really closely with Rhiannon, our development worker for Lichfield, to make sure that our youth organisations, our members, were also tied into that. So yeah, we've been heavily involved with the the pre-arrival, but also making sure that we have that impact. And again, that we're not saying to young people, we bought this here because we've got an issue. Actually, we don't have an issue with knives in Lichfield. This is very much about saying, you know, this is one knife is too many. How do we, you know, what are the reasons people are carrying knives? And to start those conversations. And we had one school, their little ones, their year ones, did some posters that I went to collect on Monday that will be displayed in Tesco's. And the parents and carers have said it's great for them because they're able to start having conversations with their children and young people, so that they're able to have a conversation they may not have been able to have through that monument being in the district. And we've seen, you know, Cannock have embraced it, Tamworth have, so it's also had that link in with the neighbouring boroughs. Did you want to say anything else about the Knife Angel?
Not particularly about the Knife Angel. I guess that's an example from Lichfield. There have been others in terms of Cannock around antisocial behaviour and gangs, with, some work done in Tamworth as well. A little bit in Newcastle, and I guess this is the strength potentially of us as an organisation hosting this role and this service, is that we've been able to make that join up with our local development officers who are very much involved in the partnership conversations and activities, and make sure that the education element is a key part of the prevention. So not just responding and reacting to what's happening, but actually making sure that education for young people, but support for schools is there, so that hopefully, and it's going to be a long process, isn't it? It's potentially generational, but 10, 20 years time, if this is strengthened across all of our schools and all of our education providers, then hopefully we're going to have a whole bunch of children and young people growing up making wiser decisions based on the decision-making skills that they've learned, the knowledge that they have, and all of those kinds of things. So it feels like it's a generational thing, and I just hope that that's what the wider partnership see the benefit of it in this 3-year programme initially, so that it can be continued in the longer term.
But any support to help with building those relationships would be greatly received, because I am, as Phil said, one person. So there is Ellie and I. It's slightly easy for Ellie because Stoke's quite contained. So she's got one council, one partnership to deal with, whereas I have 8. And obviously geographically we're quite spread, and there's a lot of diversity and different needs across the district and boroughs as well. So any support to be an advocate for us, or to, like I say, I'm happy to come and talk about the service at any meetings that you think are appropriate.
Councillor Eaglen, please.
Yeah, thank you very much. It's nice to see you again, Phil. Nice to see you both. Just as a point of information, I represent the Staffordshire County Council on the Family Involvement Board, and from that, going to those meetings, I have the responsibility of emailing all the councillors in my division of what happens at that meeting. Unfortunately, the meeting last Thursday took place and I wasn't able to go because I was in here at full county council meeting. But at those, before COVID took a grip of us. We'd meet very regularly, and lots of people, skivvies would always be there, their representative, and lots of other people giving all their information, not just to early years children, but across the board of children of all ages. So it was a good and it was a solid, I came away with good pieces of information to pass on to my members of the County Council. But since COVID, it's been taken on Teams and it is not the same. And I was really looking forward to the face-to-face meeting, but I couldn't get there last Thursday. But what I have arranged to do is we've got a new group leader called Danielle Stewart. She is the new person leading this in Lichfield, and so we've arranged to have a Teams meeting together to discuss the meeting last Thursday and to bring me up to date. So my members of the Lichfield District County Councillors, I'll be able to send them a report which includes this one from Skivvies.
We did have that very discussion at our team meeting this morning about that hybrid meetings don't always work. They either need to be in person or virtual, depending. But yeah, we feel your pain there. But yeah, I think we're linked in with Danielle because she's the family hub lead, is she, in the district? So yeah, and obviously that's a critical part of our work around early help, which again, as Natalie said, the education prevention side fits clearly into. So yeah.
Councillor Daisy, please. Juliet.
Thank you, Chair. The comment was made about whether some of the subject matter is quite negative or whatever, and thank you for expanding that there is a much larger list. But for me, it is a case of giving young people the information with which to make the right choices, equipping them with the skills and the arguments that they can use to support other young people as well, and without getting too sentimental about it, and going out there and hopefully creating a better world for everyone. So thank you for what you do. Okay.
I'm into inclusivity, but I'm a governor to state, well, I've just stood down as a Catholic school governor after 13 years. I'm now at another church school. Do you do separate packages like for Catholic schools, really? Because the sexual side, please, and the social side, maybe, or a Muslim school or a Sikh school, may be slightly different than a general topic package?
We don't, because the Catholic schools have 1010, so that's already in there, and we link in to 1010. I've done the training for 1010 as well. So we don't, in terms of create those things there. What we do have is in the framework, it very much says about making sure that we are reflective of the protected characteristics, which also links in with the Ofsted framework around spiritual, moral character education as well, and British values. So we do reflect those things, but in terms of that specific resources for them, we don't, because they're already covered, and the Catholic schools love them and there's positive feedback about them. So because there's not a gap where we've got things that there are a gap. So for instance, antisocial behaviour in its own right isn't a topic that's covered within either the PSHE Association or within the government statutory guidance, but is very much a need within our local context. So through Safer Streets 4 funding, we are creating a comic book for our 9 to 11-year-olds to look at what might the impact be of antisocial behaviour, and we're creating a film for 11 to 14-year-olds again, so we're looking at what's our local need. There's about 25% of a curriculum that you can flex within schools. Obviously, within youth organisations, they have a lot more flexibility. But within our schools, they have about 25% where they can do the local context. Everything else is governed by the Department for Education. So we very much make sure that we cover off the statutory information so that schools are able to meet their obligations. But to just meet your obligations is not good enough for our children and young people. So we need to make sure that we're, again, reflecting Staffordshire and Stoke, because like I say, we do work across both areas, and making sure that when we're having the conversations about child exploitation, if somebody thinks, well, actually, I think my friend might be at risk of that, we've opened Pandora's box, so what do we do with that? So again, making sure that everybody is aware of that signposting information and who the right people are to be signposting to, so that we're fully safeguarding children and young people, or if they've got any questions or they want more information, they've got places that they can go to. So we're taking that full approach and not just saying, right, we've done the topic, see you later, that's enough. So we very much embed, and that's why, you know, with all the things that were coming out of Westminster with the Miriam Cates report, MP report, about some of the horrific or RSHE resources that were being used. We didn't recognise the contents of the report. We do recognise that there are people out there delivering who haven't been trained appropriately. So that's why we created the best practice for using external providers and the quality assurance framework for resources as well. So people were using resources that we hadn't necessarily seen, and quality assurance that are on the website, that we'd empowered our education providers to be able to do the right checks and balances to make sure that we didn't have people going into our schools, colleges, alternative providers, youth organisations who were not of good quality and giving messages that were not appropriate to our children and young people.
Are we free to distribute this to all our councillors and anything else you have that you feel that could go to them, really, exactly what we can gain from it, the better. Before you came in, we were talking about preparing children for adulthood. And really, a lot of what you're doing in schools here, hopefully, will prepare children for adult, really. I mean, if we can add little bits like Councillor McMahon said about cooking, perhaps home preparation, hopefully it'll also make them better parents. So it may, I mean, you already talk about domestic violence. Domestic violence is learned behaviour, I shall lecture on it. And if people see things in the house, then they pick it up as the norm. So can I thank you for what you do, really, in the schools and assist our schools, education establishments and everything across the county. Thank you much. Thank you. Mark, anything you want to finish with? Okay. Thank you very much. If you wish to go, please feel free to. I know you have long days, but Phil, so... Will you be with us with the Bremen children next month? Good. I didn't want to go out just. Okay, no, thank you very much. Item 7, the work programme. I'm going to hand over to Deb on that, please.
Thank you, Chairman. So in your pack today, you've got the work programme on page 77 through to 84. Following the focus of the last meeting, the 15th of June, and the extra meeting on the 10th of July relating to future items, and also a subsequent work programme planning meeting, the following additions and amendments are proposed for your work programme. On page 79 of the pack, on the 14th of September, it's proposed meeting will focus on the impact of extra cabinet funding for children's services. Placement sufficiency has also been requested. However, this is an area of focus for the senior leadership team and cabinet away day at the end of September, and therefore will come to the November meeting. Items on the work of the Family Improvement Board and the Children in Care programme have been added in its place. The second point is that an informal meeting has been arranged with the Police, Fire and Crime Commissioner on the 24th of October at 2 o'clock in the county buildings to consider 3 key areas, these being 1, the response to the Peel review and the impact of changes made to date. Secondly, the neighbourhood safety delivery process to enable members to better understand and inform their constituents. And thirdly, the Humberside pilot project, Right Care, Right Person, whether Staffordshire are following this method of working with those who have mental health concerns and the potential impact of this. The next meeting is the 23rd of November on your programmes on page 79. It's proposed that 2 trading standard items have been requested. One to look at the impact of service and its work to maintain a safe marketplace, and the other to consider the issue of non-compliance vaping and the safeguarding concerns around that, particularly considering the way that vaping is impacting on children and young people. And finally, Chair, other items that members prioritise during their planning session will be added to the work programme, and any suggestions from today's meeting.
Janet?
Yeah, I'm pleased about that last statement, Chair, vaping, because that was one of the questions I asked when we were doing the pre-meeting. So I'm glad it's going on to that programme. Thank you very much.
I like the vaping bit as well, but it's both a safeguarding issue and a health issue, most probably, and it's not clear to me where it ought to sit. And I just think that needs due consideration. And perhaps some members of the, maybe I'm over-egging this, but perhaps we should invite Jeremy, for instance, to come and sit on that particular item.
Thank you, Councillor. The remit of health is to look at the impact of health, vaping on health, whereas the remit of this committee may be the safeguarding of children from purchasing vapings.
But the issue is health doing that? And if not, then it might be worthwhile inviting Jeremy to come here, and then he can take his thoughts away and consider what he might want to do for health. I think it's something that should be felt. One thing that was never mentioned during the pandemic is that the virus spread through droplets. And what do you produce when you vape? Personally, I ran 1 million miles away from vapors during the pandemic for that very reason. So there really is a public health issue there.
Yeah, it's quite right what was just said. The reason I asked the question was because of my contact with schools, senior level of schooling, and how it is a problem at the school children. They seem to have pocket money enough to buy these things and to use them, and it's on the increase. It's just like years ago when you could have your first alcoholic drink. It was good, it was fun, you know, you were showing off. And this seems to be the latest showing off point that's going on with the young people, and they need to know how dangerous it is. It's so much more dangerous, I've been told, than the actual smoking of cigarettes. But I am pleased it's on this agenda.
For me, Chair, I automatically thought of it as preventing and stopping the accessibility of the vaping devices or whatever they're called. Thank you, Chair.
What I shall do outside the meeting, I shall ask Jeremy Pert, Councillor Pert and Councillor Bob Spencer to discuss it really. When we look now, certain states in America have banned vaping for health grounds. Certain Canada is looking at it in some of its provinces now. But if I go through Canada now, there's that many outlets where you can purchase a vaping, whatever it is. As Councillor said, I keep away from it, really. If we can look at the health side through health, we too, I mean, the way I look at things, if we cut off the access to it, we're looking at the health side at the same time, because if people can't access these things, they can't use them. So I think really it's a matter between the two committees. Yeah. But I shall ask Councillor Spencer to talk to Councillor Pert, then we decide where we go for the future from it.
It's easy access. In the supermarket, for goodness sake. You know, yeah, I take on your point, Chair.
I think really it's more national legislation we're going to need if we're going to go that direction, but we can always make recommendations to national legislation. Councillor McMahon.
The extent of the safeguarding issue for us is contingent upon how unhealthy it is. The more unhealthy it is, the more it's a safeguarding issue for us. And therefore, that's why I think we need some dialogue between us and Jeremy to get to the bottom of this.
Thank you, Chair. Can I ask, through you, for members to approve the additions to the work programme?
Anything else? Anything else you want to add to it before we close it down? Any other business anybody wants to bring up before we do close? Councillor Wilcox.
Chairman, the only thing I just wanted to mention, in the item with regard to the complaints and compliments, there was this talk of this workshop on the 23rd of October. I haven't got it in my diary anyway. I just wonder, is that to come out in the future?
There's been an email about it.
Thank you.
Have we?
Can I just clarify? It's Health and Care Overview and Scrutiny Committee,
Oh, right.
who are doing some work on the adult social care side of things. So it's actually Health and Care Adults Overview and Scrutiny Committee, not this committee, that's doing that workshop. No. However, I'm sure that you may be invited.
23rd of October is the Police Commissioner.
Oh.
Yeah, sorry. 23rd of October is the Police Commissioner. At a meeting, I think it's 2 o'clock in the afternoon. When the 24th. 24th, is it? The October one is the Police Crime Commissioner. Yes. Okay, I'll call the meeting to an end. Can I thank everybody? Thank you.